In this video, we're going to go over the cranial nerves and how to test them. The brain must communicate with the rest of the body. One way it can communicate with the rest of the body is through the 12 pairs of cranial nerves, which are going to arise from the base of the brain. These are going to exit the cranium through foramina. They lead to muscles and sense organs located mainly in the head and neck. Here we can see where the 12 pairs of cranial nerves originate from the brain. Here's cranial nerve number 1. Here's olfactory nerve. It originates right there. Most motor fibers of the cranial nerves begin in nuclei of brainstem and lead to glands and muscles. The sensory fibers begin in receptors located mainly in head and neck and lead mainly to the brainstem. Most cranial nerves carry fibers between brainstem and ipsilateral receptors and effectors. So what does that mean? Ipsilateral means that would mean same side receptors and effectors. So that makes sense. If there was a lesion in the brainstem, it would cause sensory or motor deficit on the same side, since these fibers are running to the same side, ipsilateral side receptors. Exceptions to this would be the optic nerve. Half of the fibers decussate, which means cross over, and the trochlear nerve. All afferent fibers lead to a muscle of the contralateral eye. So that means opposite eye. So instead of ipsilateral eye, it would be contralateral, which means opposite eye. Ipsilateral, same eye. Contralateral would be opposite eye. So we classify cranial nerves as either motor cranial nerves or sensory motor nerves, or also mixed cranial nerves. So if they're mixed, that means are delivering both sensory and motor. So here we can take a look. So the sensory cranial nerves are purely 1 and 2 are purely sensory, and then we also have cranial nerve 8 as well as the sensory cranial nerve. The motor nerves are 3, 4, 6, 11, and 12. Those are purely motor. We also have mixed. Our mixed cranial nerves are 5, 7, 9, and 10. So the motor ones, of course, they're going to stimulate muscles, but also they're going to contain fibers for proprioception. And the mixed ones are going to have sensory functions and also motor functions. So for an example, the facial nerve, cranial nerve number 7, has the sensory role in taste and motor role in facial expression. So you're going to definitely want to learn some mnemonics for this to keep everything straight. So here's a mnemonic here. So on occasion, our trusty truck acts funny. Very good vehicle anyhow. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal nerve. So if you can memorize this, then you know what the first letter is. So on occasion, our old trusty truck. So on for olfactory. And then you can also put in this other mnemonic. Some say merry money, but my brother says big brains matter more. So that'll help you keep it straight, whether the nerve is a sensory nerve, or if it's a motor nerve, or if it's a mixed nerve, if it's both sensory and motor. So right when you get your test, I mean, I would highly recommend until you have this down. And even when you have it down, just to double check yourself to make sure that that you're understanding it correctly. Make sure you're able to write this down, all this information down, so you know that you're doing things correctly. So definitely pick up a mnemonic. It doesn't have to be this one. This one's it's an easy one. There's many other ones out there to learn as well. So whatever mnemonics work for you, highly recommend using them. Let's talk about cranial nerve number one. So cranial nerve number one is the olfactory nerve. So the function of cranial nerve number one is your smell, your sense of smell. So cranial nerve number one is purely a sensory nerve. And you can see right here, so here's a cranial nerve number one, the olfactory nerve. So this is your sense of smell. So this is inside your nasal cavity here. So how would we test this? So in the lab we practice different tests, and you're going to do tests on patients in the future. Just test their sense of smell. In the lab we typically use a canister of a cotton ball dipped in vanilla. So we close one nostril so we can isolate the one side of the cranial nerve, because we have two pairs. We have a pair of cranial nerves, so we want to isolate that one cranial nerve, number one. And so you would close one nostril, and then you would have the patient inhale try to smell the canister of vanilla or coffee or clove oil, something like that. And then you would just switch off. So you would close one nostril, have them inhale, try to smell that through that nostril, and then you would do just the opposite and close the other nostril and have them try to smell with that other nostril. And that's how we typically test the olfactory nerve, cranial nerve number one. Now let's take a look at cranial nerve number two. So here you can see, here's cranial nerve number one, the pair right here. And then now we have the cranial nerve number two, the optic nerve. So the optic nerve, the function of the cranial nerve two is it is vision, of course. So there's a few different ways we can test the optic nerve. So we can inspect the retina with an ophthalmic scope. So we have a scope we can look into, and you would place it right here. You can look into, actually, you can look at the retina of the eye right here, inspect that cranial nerve number two back here. We can also do tests for peripheral vision and visual acuity. So for visual acuity, we can use that standard, the Snellen eye chart. We can test their visual acuity. And for peripheral vision, we can test this in the lab or on a patient in a clinical setting. You can put your, basically, so this is anterior here, up here, and the patient would be looking forward. You would take your finger here, you could put another finger over here, and you would slowly move these forward until the patient can see them, because then you're testing their peripheral vision here. So once you get to here, hopefully they were able to see your finger come around the side of their head, and then you can see over here as well, and they would you would have them let you know when you can see. Then we could test their peripheral vision. Now let's go over the oculomotor nerve. So this nerve controls muscles that turn the eyeball up, down, and medially, as well as controlling the iris, lens, and the upper eyelid. So if we take a look here, so this is the oculomotor nerve here. So it controls most of the eye movements, the ocular movements of the eye. So a lot of those ocular muscles are controlled by cranial nerve 3. To test this one, we would look for differences in size and shape of the right and left pupils. So you could look into this pupil here, and then you could look on the other side there. We can also shine a light we can test the pupillary response to light. So we can shine a flashlight into, or a pen light into this eye, and see if the pupil will constrict. So normally the pupil will constrict. You could also test it just on one side by putting your hand here, so you could block the light from going in the other eye. Make sure this one constricts. Also, the one over here should also constrict as well, so you can test it that way. And so we're going to go over a few different ways to remember the mnemonic. Also, one other thing that the cranial nerve 3 does, it also has to do with accommodation, which is you focusing far and focusing near. So that's another way we can test that. So I'm just going to go over a few different ways to remember the cranial nerves that that control the ocular muscles. So here's a mnemonic that I teach students so that they can keep this all straight. So this is a mnemonic. So LR6, SO4, all else cranial nerve 3. So this is telling you that LR6 stands for lateral rectus. So the lateral rectus, which is an ocular muscle, is innervated by cranial nerve 6. SO4 means the superior oblique muscle, which is an ocular muscle, is innervated by cranial nerve 4. All other ocular muscles are controlled by cranial nerve 3. So all other ocular muscles are innervated by cranial nerve 3. So what does that mean? So that means when we're testing, we can test eye movements. So here's the patient here. To test these cranial nerves 3, 4, and 6, we could have them follow your finger. So you'd have them go here, here, here. You would do different patterns to test all the different ocular muscles. So by knowing this information, we can actually narrow it down and figure out which cranial nerve is damaged. So if the patient can't move their eye, they can't look inferior and medial, both inferior and medial, that is the superior oblique muscle which is controlling that, and that would be cranial nerve 4. So SO4, superior oblique, innervated by cranial nerve 4. So if they can't look down and in, inferior and medial, then there's a problem with their superior oblique muscle, which is innervated by cranial nerve 4, so there's a problem with cranial nerve 4. If they can't move their eye laterally, that movement is controlled by the lateral rectus muscle, which is one of your ocular muscles, and that's innervated by cranial nerve 6. All other failed eye movements is a problem with cranial nerve 3. So this is an easy way to remember it. This is the best way to remember what's different. If you remember these two, these exceptions, the LR6 and SO4, the superior oblique and the lateral rectus, cranial nerve 6, and then superior oblique, cranial nerve 4, then you'll just remember that all other movements that are failed will be a problem with cranial nerve 3. So now here is cranial nerve 4. So this is a trochlear nerve. And the part of our equation, we had the LR6 SO4. And so this is the SO4, superior oblique, controlled by cranial nerve 4. So we would test this cranial nerve by having the patient look down and in. If the patient's not able to look inferior medially, then we would think that there would be a possible problem with cranial nerve 4. So I just kind of skipped cranial nerve 5. We wanted to jump right to 6. Then we'll go to cranial nerve 5 in a second here. But I wanted to keep the cranial nerves that control the ocular muscles together here. So here is your abducens nerve, your cranial nerve 6. You can see that that is actually innervating the lateral rectus muscle. So when this contracts, you are able to look laterally. So if you're having the patient follow your finger and you're moving it across here, and they can't, and you're moving your finger laterally across here, and they can't look laterally, then that could be a problem with cranial nerve 6, because cranial nerve 6 controls that lateral rectus muscle, which is going to allow their eye, this eye, to look over here laterally to the side. Now let's talk about the trigeminal nerve, which is cranial nerve 5. So this is the largest cranial nerve, most important sensory nerve of the face. So we're going to have 3 divisions here. We have the ophthalmic division, which is sensory. We have the maxillary division, which is sensory. And then we have the mandibular division, which is going to be mixed, both sensory and motor. So let's go over the ophthalmic division. So the ophthalmic division has sensation to this portion of the face here, so that includes pain, temperature, and touch. Then we have the maxillary division, which is going to do sensation to this portion of the face here, so that's your maxillary division right there. Then we have the mandibular division right here. So this is going to do sensation here. And remember, the mandibular division is actually a mixed division. It's not only sensory. So it's also going to do it's going to control the muscles of mastication for chewing. So you can see that right here. It's going to control those muscles, which is going to allow you to chew. So let's go over how you can test the different divisions. So for the ophthalmic division, you can actually test it. It's using the corneal reflex. So basically you have a cotton ball and you're going to touch the patient's cornea. So you're going to touch their eyeball with the cotton ball, and that will cause the corneal reflex, and they should blink. So you're going to use a very light and soft cotton ball. Also, we have the maxillary division. You're going to test the sense of touch, pain, and temperature with light touch, pinpricks, hot and cold objects. So we can use sensory sensation to this portion here. Also, we can do the mandibular division. We're going to assess the motor of mastication. So we're going to have the patient clench their jaw and make sure they're able to do that. So you can place your hands on the side of their jaw, and you can have them clench. You're going to feel those muscles of mastication enlarge and flex, so you'll be able to see that. That's another way we can test that. You can also open the mouth against resistance, so you can put your hand down here and have them push down. They can move that mandible against you. You can also have them move it from side to side, move their mandible from side to side. That's another way we can test it as well. So now let's go over the facial nerve, cranial nerve number 7. So that is a mixed nerve. So we have two different functions here. We have a motor function, and we also have a sensory function. So for the motor, the facial nerve provides major motor nerve of the facial muscles, facial expression, salivary glands, anterior nasal and palatine glands. Sensory, we're going to provide sensory to the taste of the anterior 2/3 of the tongue, and the posterior 1/3 of the tongue is going to be cranial nerve 9. Damage of cranial nerve 7, you could have produced sagging facial muscles and disturbed sense of taste, no sweet and salty. Those senses could be diminished there. Clinical test, we could test the anterior 2/3 of the tongue with sugar, salt, and vinegar. We could test the response of the tear glands to ammonia. We could test the motor functions by asking the patient to close their eyes, smile, frown, whistle, raise their eyebrows, etc. So here we can see the facial nerve, cranial nerve number 7. We can see the different areas it goes to. So there are 5 branches of the facial nerve. Here you can see those. So the temporal, the zygomatic, the buccal, the mandibular, and the cervical. So you can memorize those. You can either think about where it's going. So temporal, going to the temple here, zygomatic, buccal, mandibular, and cervical. So they all are going to these different areas. So that helps you understand, helps you remember which is which. There's another mnemonic. It's 10 zebras bit my chihuahua. You can use that as well. Now let's talk about the vestibulocochlear nerve, which is cranial nerve number 8. So the whole function is going to be hearing and equilibrium. So we're going to test this. We can test this by testing their hearing, the patient's hearing. We can test their balance by having them checking their ability to walk a straight line. So now let's go over cranial nerve 9, which is the glossopharyngeal nerve. So this is a mixed nerve, so it has both sensory and motor functions. So the motor function is going to be salivation, and swallowing, and gagging. The sensory function is going to be taste to the posterior 1/3 of the tongue. Also, we're going to have touch, pressure, pain, and temperature for the tongue as well. We're going to also have some regulation of blood pressure and respiration. So how would we test this nerve? So there's a lot of things going on here. So we would test the gag reflex. We would test the ability to swallow, have the patient cough. We can note any speech impediments, test the posterior 1/3 of the tongue with bitter and sour substances. So I like the way I remember the glossopharyngeal nerve, and that it provides sensory to the posterior. It provides taste to the posterior 1/3 of the tongue. You just remember the mnemonic bitter back 9. So cranial nerve 9 is going to, it's going to have sensory to the posterior 1/3 of the tongue, and that's where you have the bitter taste, so you can test it with a bitter substance. So now let's talk about the vagus nerve, cranial nerve number 10. So it has the most extensive distribution of any cranial nerve. We're going to see in the next graphic that's going to come up. Its major role is in the control of cardiac, pulmonary, digestive, and urinary function. So it is known as the wandering nerve because it has, although it is a cranial nerve, it spans all the way down to the digestive and urinary system. So you're gonna see that it's responsible for swallowing, speech, regulation of the viscera, and damage can cause hoarseness or loss of voice, impaired swallowing, and fatal if both of these nerves are cut. So it's a very important cranial nerve. So here you can see the vagus nerve. The vagus nerve is very important. It has, it's connected to a lot of different organs and structures, and it's very important organs, of course. You can see why it's called the wandering nerve, because it's going to go all the way down here. Most of all the cranial nerves were just, really focusing on this area here, but not this nerve, the vagus nerve. Very important, known as the wandering nerve. So we can do a few different things. We can check to test this nerve. We can test the gag reflex with a tongue depressor. We can check for the weak or hoarse voice, inability to cough forcefully. Also, we can also have the patient open up their mouth and say ah. Use the tongue depressor to look in there, shine a light in there. You can see if when they say ah, if the uvula is deviating one way or the other, that can indicate a problem with this nerve. So now we move on to cranial nerve number 11, the spinal accessory nerve, also known as just the accessory nerve. So this nerve is going to innervate the trapezius muscle and the SEM, the sternocleidomastoid. So specifically, how you can test that? It also innervates, helps with swallowing as well. But the big way to test this would be have the patient shrug their shoulders against resistance. So you can put your hand on their shoulder here, have them shrug it up, or you can have them turn their head, so activating that SEM, the sternocleidomastoid. You can test that way as well. Lastly, we have the hypoglossal nerve, cranial nerve 12. So this is going to be a predominantly motor cranial nerve here. So it's going to control the tongue movements of speech, food manipulation, and swallowing. We can test this by having the patient just have them stick out their tongue, retract it, test the ability to protrude your tongue, stick out the tongue against resistance. You could do that as well. So this is a summary of the cranial nerves with some graphics here to remind you of their functions, and the functions will remind you how we can test them. So now let's go over a couple cranial nerve disorders. So trigeminal neuralgia, also known as tic douloureux rex, is recurring episodes of intense stabbing pain in the trigeminal nerve area near the mouth or nose. Pain is triggered by touch, drinking water, not just water, but any drinking, washing the face. Treatments may require cutting the nerve. So I've actually had a patient with this. I was treating her for neck pain, but she would get episodes of trigeminal neuralgia. So they would just come on from sometimes triggered by touch, drinking, or washing the face, things like that. And they wouldn't last very long, but she would have that, and she would usually do just some pain relievers and it wasn't that bad, I guess. I mean, it was manageable. It wasn't comfortable, but it was manageable. She did not have to get that nerve, cut that nerve out, because it wasn't as severe. But some people, if the pain is not manageable, they may want to or require the cutting of that nerve. Also, we have Bell's palsy. This is the inflammation of the facial nerve, which is going to cause weakness of facial muscles. This patient would have sagging, their mouth would be sagging, their eyelids would be drooping, so it would really affect their facial muscles, and you would be able to see that.